coordinator here at Commemoration Zambia. And basically, I do all things youth care. I think this project it started way back in somewhere March, and I have been practically implementing this project with my colleague Wankumbu here at Commemoration Zambia. Thank you so much for having me.
Thank you very much, Melody. I'm yet to see Anthony. Anthony, are you already in? Good morning to you. Hello, Anthony. Okay, probably Anthony should be joining us in a bit. I know most of you colleagues are joining us now. Thank you very much for joining us. I'll be your host for today. My name is Wankumsi Mkonda, and like Melody has mentioned, I am working with Commemoration Zambia, and I'm the district coordinator for the youth care project here on the Copperbelt in Kitwe and Kalulushi districts. I'm glad to see most of the peer educators joining in, and some of the volunteers at Commemoration Zambia, and some of the volunteers who are working in Kenya and Tanzania. This is your session. Let's flood the chat with those comments, contributions, and questions as we discuss the role of young people or youths in self-care delivery. And to start with, I'll start this discussion by asking my panelists, what is self-care and why is this important? I'll start with you, Melody, once more.
Thanks, Wankumbu. So when it comes to self-care, self-care really has a broad definition, but basically we can understand it as just a way that individuals, things that individuals practice to care for their well-being. This could be with regards to their physical, emotional, mental, as well as sexual well-being. So it could start from simple things like exercise, eating healthy, wearing a seatbelt when driving, just simple things that individuals practice when it comes to taking care of their well-being. However, referring to the World Health Organization definition that you earlier stated, self-care basically means the ability for individuals as well as communities to take care of their health, maintain their health, and also prevent disease with or without the help of a healthcare provider. So self-care interventions really acknowledge the important role that individuals as well as communities play in their own health. And self-care interventions sort of shift away from solely depending on the traditional health facilities that or centers that have been designated for healthcare. And when it comes to your second question on why self-care is important, basically you see that self-care is, even as countries move towards achieving universal health coverage, self-care remains a sustainable and cost-effective approach to achieving universal health coverage, especially for SRHR. And this especially is very important for individuals that have face challenges, for example, due to poverty, maybe distance to the health facilities, the lack of privacy. And when we bring it down to this group of youths or young people, young people are very private people. They do not want their issues to be out there. So many of them face a challenge of accessing health services, especially with regards to their SRHR in the designated health facilities. And so self-care really brings in that, bridges that gap where an individual fails to go to the health facility for fear of stigma or even the lack of privacy, and comes in to resolve such issues such as that. So self-care is very important, even as we draw we are all looking at achieving the Sustainable Development Goals in 2030. We're looking at reducing teenage pregnancies as well as adolescent birth rate. We're also looking at decreasing the adolescent HIV infections. And so self-care becomes very cardinal in that in those areas, because now we are giving the power to individuals to really take care of their health, but also not just solely depend on the healthcare provider, but put in certain interventions that can help them take care of themselves. So I think I'll end here for now. Thank you so much.
Okay, great. Thanks very much, Melody. So that's Melody there from Koparos, Zambia, giving us an insight and the understanding of what self-care is and its importance. I now move to Jerob. Jerob, same question to you, your understanding of what self-care is and its importance, especially on a day like this one when we are celebrating the International Youth Day.
Thank you, Nkubu, for your question. For me, self-care is taking my medication. For the longest time, being a child, I always thought and imagined that my parents would be there to always remind me, take your medication at this time, make sure you eat. If you're feeling unwell, make sure you say and communicate so that we know what to do. And when I became an adult and even moved out of home, and I literally had to start taking care of my own self, making sure I am taking my medication on time because there's nobody to remind me. It's only my alarm. Making sure I take care of my body because it's important. Making sure I don't miss to eat. I make sure I try as much as possible to eat fruits and not junk all the time. So all these little things that contribute to the wellness of my body is self-care for me. But majorly as a young person on care, it has been consistently taking my medication without missing and making sure I am very keen in noting whatever is happening with my body, because those are the things we sort of don't pay attention to. Maybe you have a cold and you just ignore and you go and buy medication over the counter. You're coughing, you don't go to the hospital, you just find a cough syrup and you say it will go away. During the COVID period, we were taking a lot of ginger, lemon, and honey mix to take care of ourselves. But instead, that might not be the right way to take care of ourselves. So for me, it is consequently paying attention to my body, how I feel, how am I doing? Am I okay? How is my chest? Am I coughing? Am I taking my medication as I am required? Do I need to access some supplements? Do I need fruits? And all these small things that contribute to the wellness of my body, for me, that is self-care. Yeah. Why it is important? For me, it is important because I want to see the next day. I literally just want to wake up the next day healthy, energetic, okay, and able to do my work as I'm required, able to show up at work, able to live my normal life as a young person. So for me, it is important because it enables me to wake up the following day without feeling sickly, without feeling weak, without feeling some type of way. So taking care of yourself is really important because at the end of the day, there's always something good about it. There's always something good about everything, because the following day you will wake up, you slept well, you took your medication, I don't have to worry about getting sick, my viral load is in check. So these small things just make life somehow easy and manageable for me. Yeah.
Okay, great. Thanks very much, Jerob. Well, I already see my inbox getting busy. Let's have those introductions and share the countries where we are coming from so that we tend to interact. It is our day. It is International Youth Day. And as we commemorate International Youth Day, AIDS Funds, together with its partners, are bringing to you this interesting conversation about self-care. And also at this particular time, I'm going to ask you, colleagues joining in virtually from Zambia, Tanzania, Kenya, and Netherlands to share what self-care is to you in the chat box. I'll be getting there to read some of your comments on what you feel self-care is or what self-care means to you. We've had a mention of how poverty, lack of privacy, taking medication, and also ginger being mentioned there. I don't know what some of my colleagues were taking from within Zambia when we had COVID-19 pandemic. Remember, earlier on, I mentioned the definition of what self-care is as per WHO, and they say that self-care is the ability of individuals, families, communities to promote health, prevent disease, and maintain health, and cope up with illness, disability, with or without support of health care workers or health providers. So we'll be getting to that. So let me see those comments in the chat box. I'm glad to see Messi, John Wansa, Grace Juma, Mwepa Jackson, Cosmas Ibrahim, Macau, Kathy, Joyce, and Boniface Muema joining us this morning. Wow. So this is interesting. So I now move to another discussion. I'm yet to see Anthony from Tanzania join us. Anthony, are you on the platform so that we could also hear from you? But we look forward to seeing you on this platform. Just go direct and unmute yourself once you get some stable connectivity there. So Melody and Jerob, for now, let's now discuss self-care in the context of interventions with regards to adolescent sexual reproductive health. Jerob, maybe this time around I can start with you. What are some of the self-care interventions that we need to consider, especially with regards to sexual reproductive health for adolescents and young people?
So just looking into the commodity stock in terms of self-care commodities in our country, we have the HIV self-test kits. We have some contraceptives. We have condoms, both male and female. We have a variety of products. But the most important thing about these products is that I really need more information about these products in order to be in a position to use these products. Most of the time when we have these products at our disposals, at the facility, at the pharmacies, and all these places we are able to access these products, most of the time as young people, we might not be having the right information on how to use it. I will give an example of a self-test kit. Once you use a self-test kit, you are required to go to the facility and do a confirmatory test. But so many young people do not feel the need to go back to the facility to get this second test to confirm the results, because for them, I am testing myself. The results that I'm given by this kit should be final. I don't need to go and get a confirmatory test. So many young people feel like this is not then a self-test kit, because at the end of the day, I'm still required to go to that same facility that I'm trying to avoid by purchasing this self-test kit. So we do have a lot of commodities, but I'll still talk about the need to ensure that these commodities also come with a package of information to fully explain how to use them, why to use them, why they're important, what to do in case of something, and even the pros and the cons, because most of the time we don't talk about side effects of commodities or drugs or medicines or even test kits. We really don't talk about them, but yet they exist. So for me, that is what I will say.
Wankumbu, I think your mic is unmuted. We can't hear you. Your mic is muted, sorry.
Hello, Melody. Okay, thanks for that. I was trying to just mute those. Please, colleagues, as you join in, let's ensure that we immediately mute ourselves so that we do not disturb the speakers. Okay, I'll be getting to the inbox shortly, but Melody, same question to you. Self-care in the context of interventions with regards to adolescent sexual reproductive health and rights.
Thanks, Wankumbu. I think Jerome has actually touched on several interventions that are available to young people for their self-care. And maybe just to add on, there are several other interventions. So for example, when you look at evidence-based drugs, you're looking at things like oral emergency contraceptive pills, the oral contraceptive pills. There's also PrEP and PAPE that can be used or used by individuals to self-care. When you look at some of the devices, there's also, Jerome mentioned the HIV testing kits. There's also pregnancy testing kits that people can buy from pharmacies and actually carry out the tests from home. And Jerome actually did mention that people should always try and seek further clarity or confirmation once they get their results that they have tested on their own. So basically, there are a lot of also platforms that they could get, young people can access to get informed about how they can self-care. So there are different apps online that people can use. I am aware of an app that was developed by CIDAS. It's called My Safe Space. There's a lot of information actually on SRHR that adolescents and young people can access, read, and get well informed about how they can self-care when it comes to their sexual reproductive health and rights. There's also information on Google can be sometimes, there's a caution there because some information can be incorrect, some information can be correct, but it's always just important to seek for sources that are quite valid sources. So you can look through some toolkits that WHO has actually developed for information. The toolkits are online and are accessible to everyone. So there are different SRH self-care interventions that young people can access. I have mentioned a few and Europe did mention a few, but there are many others, and I would like to see people adding to the chat on some of the self-care interventions that they actually know apart from what we have mentioned. Thank you so much, Wangu.
Okay, thank you very much. The confirmatory test is something that I'll discuss, especially that you two colleagues discussed about the issue of privacy. But in the meantime, I'm now going to get to the chart so that we get to know who's in the house and what their view is. Okay, Christine Kalondo says, hi everyone, I'm Christine Kalondo from Kenya. What youth organization? Okay, thanks very much, Christine. We also have got Boniface Mwema, also from Kenya, Miles Mwansa, ZNYP Plus. We have got Kathy, also coming from ZNYP Plus. We have got Bozi Badia, an affiliate of adolescents and young people, that is IEREP. There are also Juma Zuri, okay, Jessim Kumbuta, ZNYP Plus, Mes Chilufya, Koparos, Zambia, okay, Grace Mutoni, Kenya, Joyce Oma, Y Plus Global, okay, Boniface says is a member of the World Youth Organization. Great. John Mwansa says self-care has been defined as a multidimensional, multifaceted process of purposeful engagement in strategies that promote healthy functioning and enhance well-being, especially the term describes a conscious act of a person takes in order to promote their own physical, mental, and emotional health. John, Thank you very much for that. Juma says, self-care is stepping aside from toxic relationships, be it work, be it family, be it your partners. This for me is having to take care of my heart first before taking care of someone else. Well, interesting thoughts there from Juma. Okay, Peter Mwenda from IAREP also. John Wansa says HIV, condoms, PrEP, and PEP commodities should be availing for young people to access free at any point of access with no stigma and discrimination. Messi Wanjiku says, hello everyone, Messi Wanjiku from Kenya. Self-care for me is making informed choice on my health and also promoting good health in communities, friends, and family. Okay, she goes further and says, how I make sure I'm on great self-care is making sure I can easily access SRH services. My mental health is on check. I'm getting enough rest. I am having proper meals, and I am making informed choices on all aspects of life. Kathy says self-care also contributes to young adolescents who are HIV positive to take keen interest in collecting drugs on their own, on their own, and also be punctual on viral load testing, because doing so will help maintain a healthy adolescent who's able to take care of themselves is always be our slogan for ZNYP+. Thanks. Cosmas Ngoma from Kitwe says, actually self-care is making life loving yourself first. This means no one allows anything bad to happen to them. Okay, so self-care is protecting oneself in all angles of life. For example, eating good food, doing some physical activities to stretch our bodies, family planning, and other health-related articles. Okay, Bozi says, I would define self-care as watching out for self through making informed decision on matters of personal health. Okay, Miraj says, good morning. I'm Miriam Siombo from Kenya, glad to join. Thank you, Miriam. We are glad to also have you here. Jackson Chisanga from Kitwe says, I am Jackson, and I think self-care is knowing my health status, how best I can do to maintain it. Well, great. That was so mouthful for me reading all the messages, but I really appreciate that we are interacting as we commemorate the International Youth Day, and then AIDS Funds, together with its consortium partners from Zambia, Tanzania, and Kenya, they bring to you this exciting discussion. As we go on, I'll be asking you colleagues to unmute yourselves so that you can add a voice on what we are discussing on today's webinar session, the role of youths in self-care delivery. Thank you very much. And there we see I'm Alfred Longo from Chambishi Township. Thank you, Alfred, for joining us. Melody, I'm getting back to you. Earlier on in your preamble, you spoke of some sort of privacy, especially amongst us as young people. But when Jerop was discussing self-testing kits, it requires a confirmatory test. How is the privacy there if we have to then go to the facility for a confirmatory test? Because I understand that if I'm doing a self-test, meaning I don't want people to meddle into my life. What is your take on that, Melody?
Thanks, Wangombo. Well, the issue of privacy really is something that has to do with how healthcare providers really treat the information that they are availed to, or they get a privilege to. So they are responsible for the tests and all those things they conduct on adolescents and young people that go to the facility. But where they now begin to share that information without the authority of the individual. That's why the privacy issue comes in. It's not like adolescents and young people do not want to go to the facility, but they fear that when they go to the facility, their information might be not treated as private and might be shared with other people that they would not want to avail that information to. So really, on that, what self-care does there, it gives such an individual an opportunity to still do something about, to still be well informed about their health without involving those healthcare providers that they so much fear due to the lack of privacy. And in that way, at least it still gives that opportunity, an individual that opportunity to be well informed about their health and their status without really compromising their privacy principles. So basically, it's just with regards to healthcare providers. And I feel this is something that we are actually working to address as Corporals Zambia, the values clarification as Corporals of Zambia, trying to see how can we inculcate that culture in healthcare providers to be private about the work that they do, and also to respect the privacy of the adolescents and young people that they take care of. So that is something that we're trying to actually create awareness or advocate for as Corporals Zambia, that healthcare workers should go and allow them to set aside their values, but respect the individuals and adolescents that they attend to in their daily work. So thank you so much, Wankumbu. I hope that answers the question.
Okay, great. Thanks, Melody. I'll now be moving to Kenya. Jerop, we have gotten some responses and some feedback from our friends who are joining us on this webinar session. But again, based on the responses that we have gotten, what does self-care mean to the young people and the population in general? These communities where we are coming from, how should we take self-care?
I think in so many ways, we get to individually also define self-care for ourselves. I like something that was mentioned on the chat box by Zuri, that self-care for them is working out of a toxic relationship. Again, like I mentioned before, self-care is the little efforts and the little things that we get to do to take care of our own self and our own health and our own bodies. And that includes our mental health, that includes our bodies, the general well-being of our whole bodies. So I would allow us to also somehow interpret and define self-care in however it means to us. Because for me, sometimes self-care for me is just chilling, not doing any work, and just listening to music. Because maybe I'm overwhelmed from work and school and life and everything else. Sometimes self-care is talking to a therapist. Sometimes for me, that is something that works as well. And I consider that self-care. To other, self-care is chilling with a glass of wine in the evening on Friday today and just appreciating yourself for the work you've put in the whole day. And for others, self-care is also going to the facility for checkups here and there. Of course, we mentioned that self-care is not necessarily your role as a young person, but it also can be with the assistance of a healthcare provider. So self-care is defined in different ways, but at the end of it all, I'd like to believe that it is the little efforts that we put to take care of our own bodies, our own health, to make sure we are doing well, to make sure we are okay, to make sure our bodies are fine, to make sure we are taking our medication, to make sure we are going for checkups, even if you're not sick. You know, you go for these checkups, you go and make sure, you know, for girls, we go for cervical cancer screening every now and then. We make sure we check our bodies, we make sure our BMI is okay, our weight is okay, all these small things at the end of the day contribute to the word self-care. Basically taking care of my own self. That is what I will define. Please forgive my cat.
It's good to see the cat in the background there. I know maybe that could be part of self-care. Colleagues, with regards to health, I know I can now throw this this to you. And I'll start with you guys. Melody and Jerome have mentioned some of the self-care interventions and all this. And today we are celebrating the International Youth Day. AIDS Funds and its partners, they have decided us to discuss the role of youths in self-care delivery. We have talked about the self-testing kits, okay? We have talked about other interventions like the pregnancy testers and all this. Why are we having challenges? I'm throwing this to everyone. You can raise up your hand, then I'll be able to unmute, or you can go direct and mute yourself so that you should be able to speak. What are the barriers to self-care, or what is stopping us as young people from accessing these self-care interventions that we have spoken about, the family planning, the PrEP, the condoms, the PEP? What is it that is stopping us? I'll start with you, Jackson. Jackson, please unmute yourself. Go ahead and discuss. So let me give this particular order. I'll start with Jackson, Cosmas, then I'll proceed to Miles. Let's go. Then Alice will be the fourth person to speak. So I'm giving each a minute and a half to speak. Jackson, you can go ahead.
Okay, thank you for that, Mr. Wankumbu. Okay, so I think some of the barriers which hinder us as young people to accessing the same self-care services are that most of the time we find it difficult to visit the facility, and when you go there, you find that maybe the people who are there are adults, and interaction more of, we fail to interact with those adults which are found at the facility. As in, you feel shy to open up to what you want because they're actually adult and the like. Yes, that's my view as why we fail to access.
Okay, thanks very much, Jackson. We can go to Cosmas. Cosmas, you can go ahead.
Okay, thank you so much. And what I can contribute is that some of the things that stand as barriers for us young adolescents to access these services, sometimes we find that there is distance. Yeah, distance firstly contributes. Some people, they live in remote areas. They find it very difficult just to start walking. They don't even have transport. Where they are, where they live, health facilities are not available. And sometimes we find that the attitude of the same health care providers, yeah, the way they get to respond to us young people. Once you go to collect condoms, they'll say like, you at your age, you want to use them for what? That's why you even get HIV like that. I remember very well when we were in grade 12, when the madam who was teaching us biology said, tomorrow as you be coming, come with condoms because we'll be learning about family planning. So we had to go to the nearest facility to access the same, just for the sake of the same lesson that we were having. Now the way they responded, they were looking down on us. So that stigmatizes us not to be going, because they see us to be young people, so they think like we're using them wrongly. Yeah, we have gone astray. Fiber. So those things are also contributing to us young adolescents failing to access these services. And sometimes it's availability. When you go, there is shortage. They are not having these services. You come today for testing, they say you should come tomorrow, we are not having test kits. Again, tomorrow you come, you are bouncing. In the end, you just stop, like you're just wasting your time, despite above all, there is a distance to cover while coming, and you are leaving some programs behind, but you choose to go and access, and you find that they are not available. That's what I can contribute. Thank you.
Okay, thank you very much, Cosmas. I can see quite a number of hands. Well, let me go to John. Okay, let me go to, I think, Alice. I saw Alice's hand earlier on. So Alice, please go ahead and give us your view on why young people are not accessing these self-care interventions. What's stopping them?
Thank you. Actually, talking from our country, most of us, we are facing this kind of thing. It's like a stigma. And
you can also mention, Alice, you can also mention your country, please.
Okay, I am Alice from Tanzania.
Okay, go ahead.
A lot of adolescents and youth face this problem because of lack of information. That's the first thing. From the parents, from the communities that we live in. So you cannot even find a girl or a boy trying to access this kind of information because it's like they are prohibited to do so. Even your parents will never allow you to get across about condoms and contraceptives and etc. So it's hard for them to access. The other thing is the access. Let me say just from the government. They did not expose these girls to go and fetch this kind of information. That's why you'll be told like, where is your parents? You're not supposed to be here. It's like they see it's like a crime for you to access those information. So even the NGOs that work through the area try to create awareness to the community, but it's still a problem because the community still believes that there are a number of issues concerning these services. Only adults are able to access and not youth. Youth, they should just, it's like they still like you want to engage in sex, and that is not the case here. The case is having the right information. When the right time comes, then you can use it. But still, there is no access because of this stigma in our community and a lot of beliefs that things probably it can destroy our moral or what it can destroy the community, youth, and etc.
Okay, thank you very much, Ruth. Okay, I've seen that John has come. John, I'll be getting back to you shortly, but let me go to Jovin. Jovin, give us your view on this. You can unmute yourself. Go ahead and discuss. Tell us the country you're coming from as well.
Okay, yeah, my name is Jovin Juma. I'm coming from Tanzania. Yeah, I'll contribute in some of the factors that are hinder youth from accessing self-care. One being a lack of self-care commodities to our health facilities. So this is one of the things that hinder, because you can find in rural areas, these services or these commodities, self-care commodities are not available. They're only available to rural areas and few of them. But also, I can see the belief that the society has, but also the healthcare providers still have this belief that when they see a young person going to access or to help to ask for self-care commodities, they have these perceptions that he or she has started engaging himself or herself into these sexual activities. But also, I can say information, as my friend Alice said, information mostly on if these commodities are pleasant. So people don't know, mostly youth don't know. They only know about condoms, but there are a lot of self-care commodities which are available into health facilities. So if this information could be spread, maybe a lot of youth could access and these self-care services. Thank you.
Okay, thank you very much. So those that have spoken already, kindly lower your hands so that I can give a chance to those that have not spoken yet. So Jovin from Tanzania, thank you very much. I know that my chat box is also busy. Let me go to Margaret Songwe, then Bozi and Daliso, then I'll be getting to my inbox in that particular order. Margaret, you can go ahead and share your view. Why are young people not accessing their self-care interventions? You can give us the case of the community where you are coming from.
Yeah, so according to my community where I'm coming from, some youths, it is very difficult for them to access this family planning because of familiarity and also shyness. They fail to access knowing that when they go to access, rumors will be spread out. As a result, they fail to access. And also shyness. They think that when they reach at the facility, the self-providers, I will start judging them and also stigmatize them. Yeah, that's the view. That's my view about that.
Okay, great. Thanks very much, Bozi. So that's Margaret from Zambia, I think on the Copperbelt province there. So thanks, Margaret. You can lower your hand. Let me go now to Bozi. Bozi, tell us your full name and the country where you're coming from.
Hello everyone, so my name is Bozi Badia. I'm from Kenya, an affiliate of IRF. So in my opinion, I think the biggest challenge that we have right now in accessing what we are talking about is victimization. In that we see this in a lot of places in my country and other places too. Like we have not yet moved to the point where there is no victimization when you're going to maybe a facility to get some services from a healthcare provider, and that in my opinion is the biggest challenge. And also I think we have an issue with misinformation, whereby not everyone has the right information with regard to the services they are supposed to access, with regard to the commodities that we are looking for. And yeah, I think those are the biggest challenges right now. Thank you.
Okay, thanks very much. You can lower your hand as well. Thank you very much. That's Bozi Badia from Kenya right there, speaking to us on what he feels is what's stopping young people from accessing or participating in these self-care interventions. Daliso Chanda, you can go ahead.
All right, thank you very much, Wankumbu. That is Ochanda from Zambia. Yes, I want to share something that concerns that I think contributes to youths not accessing self-care and all that. So I think that the perspective of the government, how we take it as a country, on how people seem to put more importance on focusing more of distributing condoms for free, whilst they are ignoring the fact that our women need sanitary pads that they always sell. That gives an impression that it is always focusing on encouraging having sexual activities and more like bringing out the fact that the health doesn't matter that much. And if we look at in our communities, the rising of sexual teenage pregnancies have become high, and that is bringing a low level in taking care of our health. So thank you. That's my participation.
Okay, thanks. And Kathy, briefly, before I get to our third panelist, who's George. And George, remember, like I mentioned, is coming from Tanzania, and he will also be giving us his perspective on the role of the youths in self-care delivery. So I get to you, Kathy, briefly. What do you think is causing young people not to participate or access these self-care interventions?
Good morning. Thanks, Wankombo. I'm Catherine from Zambia. I just wanted to contribute on PrEP. I think the main reason why adolescents are not accessing PrEP, or we've not seen a high number of adolescents accessing PrEP, I'll talk about, look at the package. The package is more of like those that are collecting antiretroviral drugs because that's packed in the same bottle. One. Number two, you look at where they should access the PrEP food. PrEP is being accessed in a facility or in an RRT department. That's why they're accessing it. So as a result, an adolescent will not go there at the facility because they'll think that, oh, if I go there, they'll think I'm collecting ARVs or they'll think I'm on antiretroviral drugs, because you'll not differentiate between PrEP and ARVs because it looks the same package, and where to access it, it's the same ART clinic. I think those on PrEP side would be the major contributor to adolescents shunning away from collecting PrEP. Thank you.
Okay, quickly before you go, what could be the solution? What are you proposing should be done?
In my observation, like what I've seen working with adolescents, others prefer that if they could be a self-pallet delivery of PrEP, let's say you put PrEP on a self-care service like adolescent youth-friendly spaces where they can go and interact with their peers and collect it. And again, changing of the package. I think if we're to change the package of PrEP, how it's prepared, like any other drugs, or if it can be collected on OPD departments, let's say departments where they give Panadol and the rest of the drugs. I think that would help.
Okay, great. Thanks very much, colleagues. I really appreciate the fact that we are interacting as we celebrate the International Youth Day, which is being held under the theme Intergenerational Solidarity, Creating a World for All Ages, and AIDS Funds, together with its consortium partners on the Youth Care Project. We are saying, let's discuss the role of youths in self-care delivery, because we are saying youth care, my health, my responsibility. And at this particular time, colleagues, allow me to welcome George Anthony from Tanzania. George, you're welcome to this webinar, and the discussion is the role of youths in self-care delivery. Please unmute yourself and greet the people and share your perspective on self-care and the role of young people in self-care delivery. George, over to you.
Okay, good afternoon.
Yes, good
Habari za
afternoon,
mchana,
good morning.
mambo. So my name is George Anton. I'm working with a network of young people living with HIV. NYP Plus. We are based in Dar es Salaam, Tanzania. So we are the only national network of young people living with HIV. So I heard most of interesting things, discussions on self-care. So mine will be just a brief on what is the roles, which I think the role of young people should play in terms of self-care. But also before maybe going to detail about the role of young people, I should define youth care. According to me, what is youth care? I think self-care is self-defining itself. Can you hear me? Hello?
Yes, we can hear you, George. Go ahead.
Yes, so I mean self-care is self-explanatory. To care yourself. Also, can you say it's the ability of individuals dealing with illness without support of service providers? Not only individuals, also it can be a family as institution, how they take care themselves without seeking any external aid from service providers. That is my understanding of self-care itself. So in terms of what are the roles, I think we have also to discuss why self-care. Why self-care? It's very important to discuss first before maybe entering into detail about the role of young people. So I think in the African context, it's very important for maybe to advocating for or to promote self-care, because we understand how our health system is understaffed. I think everyone knows that. And according to WHO, for instance, in Tanzania, one doctor is burdened with around 20,000 patients, while 300 patients. So you see, when you promote self-care to young people, definitely you are going to reduce the burden to our healthcare systems. For instance, if maybe you want young people to test, it's not necessary to go to the facilities for testing HIV. They can be trained how to test themselves using self-test for HIV. Then that can aid in reducing overburden of our system. Also, self-care is very important in this era of COVID-19 pandemic. As you may know that how we were maybe puzzled with the situation, young people hesitating to go to the facilities, and they don't know how they can take care by themselves. So when you maybe you promote self-care, then in the times of emergency, then they can take care themselves without going to the facility. Now, in terms of the role of young people, as far as self-care delivery is concerned, I think one of their roles is to make sure that they increase literacy to the community on self-care itself as a concept and as practice. It's very important to sensitize the community because according to my experience, when we are launching the youth care project in Tarime, some participants were skeptical about self-care itself, like HIV testing. Like maybe if you allow young people to test themselves for HIV, then it can be maybe a bit challenge in terms of maybe can be shocked with the result and other things like that. Not only HIV testing, the other self-care. Some people are skeptical on that. So if we sensitize the community, we can increase demand. So we are going to maybe to increase the practice of itself. Advocate for inclusion of self-care in our policies, in our strategies, in our guidelines. Because in Tanzania, I'm not sure my colleagues will assist me if we really have maybe self-care as a package in our training programs or in our strategies. I'm not sure of that. So young people can assist on that. So if we really have, maybe we can be having that in your policies, our training guidelines, then it definitely that can be practiced in our community. But also young people can assist in conducting service quality province survey and to understand in our facilities if there is real maybe commodities or there is stock out and reports. And also exploring the self-care needs that exist in their context so that they can find innovative solutions to the same. That's all for now. Thank you, moderator, for giving me this opportunity. I think I'll be having another opportunity to share other issues with regard to self-care. Asante sana.
Okay, asante sana, George Anthony there from Tanzania. Very insightful, excellent points which have been brought out there by George. And now I'm getting back to my two other panelists, Jerome and Melody. Well, the colleagues have discussed and they have shared their perspective about this, and something that is coming out, and also what George has mentioned, is the role of the young people. But then how can we support these young people to participate in things like the surveys, do a stock on these stockouts that we have mentioned, the sensitizations out there? So I'll be getting to you, colleagues, on the deliberate measures that you and your respective organizations are putting in place in order to enable the young people participate in self-care interventions. I'm getting to my chat just now so that I read some of the comments. Okay. Juma says, fear of judgment in accessing services like condoms. Probably I'm just distributing them, but the minute I'm seen with such, I am profiled as a sex worker, or even that I have started early to have sex. Even diagnosis, most young people self-diagnose themselves, as some of these like STIs are difficult to try and explain to a medical personnel, especially if you find that the person to give you the service is a family friend or your mother or father. This is a great challenge. Well, thank you very much, Juma, for that. Chilundika Mwinga says, I also believe that some challenges that come up with accessing self-care intervention is the myth that they are associated to contraceptives. For example, family planning. We had conducted an outreach on Tuesday, and most of the youths had no idea that they could access family planning kit. Most of them believed that it was only for those that are married or couples. Well, a very insightful Mwinga there. Thank you very much. Margaret Songwe comes back, says, some is because of familiarity. They fail to access knowing that, okay, thanks. I think this was earlier highlighted in your speech, Margaret. Thank you very much. Arnold says, I'm Arnold from Tanzania. One of the main factors hindering young people in accessing friendly service under the self-care is lack of knowledge to healthcare providers on how they are supposed to provide services to young people. Did he just believe that the use of SRH is commodities like condoms is against their religious beliefs? Stigma is a huge problem. For example, some people are traveling from almost 100 kilometers for services, for fearing going to facilities nearby because they'll be exposed or fearing meet friends around. But self-care has to begin with us. Great point right there, Arnold. Self-care has to begin with us. The youth care is saying, my health, youth care, my health, my responsibility. And I like that point, that self-care has to begin with us. I'll be getting back to the inbox, but in the meantime, let me go to Melody and Jerome as they discuss some of the deliberate measures that their respective institutions or organizations are putting in place to enable young people participate in self-care interventions. Jerome, I can see you are ready. And where's your cat gone? We can't see your cat. They are part of self-care. Jerome? Okay, let me maybe move to Melody. Melody, you can unmute yourself and share with us some of the interventions that CRZ is putting in place to enable young people participate in self-care interventions. Melody?